Good afternoon and a big welcome to all of our viewers to our live broadcast from Saudi German Hospital, Dubai. We're here today with Dr. Hossam Sakar, a specialist urologist at Saudi German Hospital, Dubai. Dr. Hossam has over 8 years' experience in prostate enlargement, male infertility, and urinary tract tumors. Please feel free to drop your questions in the comment section below and we'll be more than happy to answer them as we go along. Good afternoon, doctor.
Hi.
Good afternoon. Thank you so much for joining us this afternoon. How are you?
Fine, thank you. How are you?
Good, thank you. Before we begin, doctor, would you like to tell our viewers a little bit more about yourself?
Nothing much to say. I finished as a specialist urologist in 2008 in Syria. I worked in my own clinic and in the government sector since 2008 until 2013. Then I came to Dubai. And I've been in this hospital since then.
Oh wow, that's a nice while. So today's topic of discussion is testicular torsion. Just to let our viewers know before we begin this topic of discussion is that the month of November is Prostate Cancer Awareness Month, and Saudi German Hospital Dubai has dedicated the entire month for the urology department here with us, across all branches as well, to educate all of our viewers over many variations of areas that urology actually covers, so that you can be comfortable to know a little bit more and know when to actually see our specialist for advice and any concerns possible. So why don't we dive in, doctor, by telling our viewers what is testicular torsion?
Yes. The reason I picked this topic is because now there is too much awareness about the prostate, but very less about the testicle, and especially in children. And one of the cases we're facing in the clinic and in the emergency department is the testicular torsion. Right. It happens in children mainly, and it happens in age between 10 and 20 years, up to 20 years, with a peak between 12 and 16 years. What happens is the testicle goes up in the inguinal canal and it's like it twists.
Okay.
And that causes pain to the child. So if their patients, if the parents don't bring their child to the hospital within 4 hours, the testicle can lose its function and the child can lose his testicle. That's why I wanted to bring this up, and I wanted to choose this time because this is the time for.
Of course, yes, so we're enhancing every single area,
Yes.
as is. So doctor, what symptoms reflect testicular torsion?
Yes. It starts with pain. The classical symptoms will be pain in the testicle. Now, usually children will wake up at night with pain.
Okay.
They will wake their parents complaining about testicular pain, whether it's left or right side. And most of the parents will say, just take paracetamol, take Panadol, sleep it over, it will be better next day, which is not the correct thing to do. If the pain is persistent, if the pain is recurrent, I wouldn't wait, I would go to the hospital. We have seen many cases in this hospital. People come to us and we are successful saving the testicle, because if we don't fix it in time, the blood supply will deteriorate to the testicle. So the other symptoms can be nausea, vomiting, in rare cases, painful urination. And if the parents will check the area, they will see that the testicle is not located in the normal sac. It's located a little bit up, and the position would be different.
Okay.
Okay, so if the parents see that, they need to rush with the kid to the hospital.
All right, okay. And doctor, ideally what causes testicular torsion though?
Now, I'm not sure if it's well known to people, but I don't think it is. The testicle is, in the beginning, as an embryo, the testicle is an intra-abdominal organ, and it descends later on. And when the baby is born, the testicle should be positioned in the scrotal sac. While this happens, the testicle takes some of the muscle layers and some of the fascia from the abdomen and from the abdominal wall, and it descends with it. And it forms something we call a cremaster muscle. The cremaster muscle covers the testicle and fixes it to the scrotal sac. And this muscle is supposed to protect the testicle. So if it's cold weather, that muscle will react to this and it will pull the testicle up to the abdominal area to protect it, to heat it up.
Yeah.
And if it's hot, it will relax a bit and it will put the testicle down to radiate this heat. For a testicle to function properly, it needs less temperature than the human body temperature. That's why it's in the scrotal sac. So why it happens, in some children, they have a powerful cremasteric reflex that pulls the testicle powerful up to the inguinal area. And because that muscle enters the scrotal sac in a spiral way, when the muscle reacts to that, it will twist the testicle. So this is one cause. The other predisposing factors will be the age between 10 and 20, as we said, positive family history of torsion in other young males, and something we call Bell-Clapper deformity. Like in some children, you will see that the testicle is not located in a proper position in the scrotal sac, but it's like in a horizontal way.
Right.
If the parents can see that, that could be a predisposing factor for testicular torsion. Now, what can trigger that? If the child is playing roughly, if he's playing on a bicycle after a long day running, doing sports, it can happen at night.
Okay, all right. So, doctor, now with the symptoms, do they gradually get worse? Now, you did advise if anyone has a child that's obviously in pain within a matter of 4 hours, they should come to the hospital. But symptoms, if
No, not within 4 hours.
Okay,
Within 4 hours, we should reach the operation theater.
right.
If the pain starts and doesn't respond like in 30 minutes to 1 hour, don't wait. Rush to the hospital, because we do need time to do ultrasound. We do need time to do a urine test to make sure we're not mixing things between
Right.
testicular infection, between other trauma cases. If we suspect it's torsion, we need to rush into the operation theater within 4 hours from the onset of pain.
Right. Okay, understood.
Some literature will say 6 hours, but my humble practice would say 6 hours is too long. I would rather take a child to the operation theater within 4 hours.
Right, understood. And doctor, since you've mentioned the age category, it's specific only in children, so adults are not.
No, we have seen cases, but it's not very common. We have seen 16, 20, 21, we have seen 25, we have seen adults also with this, but it's not very common.
Right, okay. So, doctor, when you've already mentioned now when a patient should be coming to the hospital, obviously, to seek treatment. Now, with the age-specific category for testicular torsion, how is testicular torsion diagnosed on your end? Like you mentioned, we do an ultrasound and a urine sample, but is there anything else in order to diagnose
Physical
them for?
exam. The most important is the physical exam. See, sometimes we might have a different opinion with the radiologist. He might say there is blood supply on the Doppler ultrasound, but if the clinician says that he still doubts that there is a torsion, he would rather do a small scrotal incision and inspect, because if we miss it, the testicle loses its function. Now, mentioning that, it's not always that the pain is persistent. Only recently I've seen a case of a young like a child who's having intermittent pain, and this is another presentation. The children might have what we call an intermittent torsion. Like he's playing, he will come back to his parents, he will complain about pain. But when he sits, when he relaxes, the muscle will relax and the testicle will go back to normal position.
Okay.
And the pain will disappear. If a child is complaining from recurrent testicular pain, then yes, we would advise him to be brought to the hospital to be checked by either a urologist or a pediatric surgeon.
Right, okay. And can testicular torsion actually recur in children as well?
Yes, it can. Now, if we suspect there is torsion in one testicle and the doctor is operating on it, he needs to fix it. So once we reduce the torsion, we fix it in the scrotal sac, the other testicle should be also fixed at the same time, because if a deformity is happening on one side, it can be on the other side. So there is no sense of doing one surgery and missing the other. So it has to be bilateral, both testicles at the same time.
Okay. Doctor, can any measures be taken to prevent testicular torsion from happening?
No, we cannot do anything about it. If it's going to happen, it's going to happen. What we need to do is just open our eyes, and if the child is complaining, bring him to the hospital. You can't prevent the child from playing around, from going, doing sports. It's a life thing. He has to do it.
All right. So, doctor, what happens if if testicular torsion goes untreated? If it's overlooked? I'm sure there are cases that are like that,
Yes. In these cases, the testicle will become atrophic. The blood supply will be cut off, and the testicle will, if there is no intervention done, the testicle will start to shrink in size. The pain will disappear after 8 to 12 hours. It will completely disappear, and the child will have absolutely no pain. And he will think it's nothing. But over 1 to 2 months, the testicle will shrink in size, and it will become atrophied and very small and tiny. Okay.
Right.
Now, literature will have different opinions on whether it can affect the other testicle or not. But the autoimmune architis is mentioned in some literature, and in those cases we still prefer to remove the testicle, not to affect the other testicle. And still we have to fix the other testicle if this happens.
Okay. All right. So, doctor, what are the treatment options available for testicular torsion?
It's only one option. It is surgical intervention. tiny scrotal incision to fix it with 1 or 2 stitches. Now, there are other types of treatment, conservative, but I don't really agree with it. They can do a small movement called reduction of the torsion, closed reduction, which means the doctor can do an attempt to fix the testicle back to its own position. Yes, it is successful in many cases, but this is a temporary measure, just to bring back the blood flow to the testicle. That doesn't mean it's not going to happen again. It will happen again, and it needs to be fixed in the scrotal sac.
So definitely surgery. So doctor, as you said, now from the time of onset pain to going into surgery, in your opinion, it should be within a matter of 4 hours. With that regard, a child has gone in for surgery, we'll say, what is recovery like for your patients post-surgery?
Yeah, it's very fast for children. Usually it's 48 hours, maximum 3 days, that's it. And the child will be playing again, everything back to normal.
Right, and do they have to come back to you for any follow-ups post-surgery?
Yes, we have to check the testicle again, check the blood supply with ultrasound Doppler, make sure that the wound is fine, there is no infection, and yes, that's it.
Okay, all right, so doctor, a question that we did receive, maybe it was out of confusion, was, since you said it was very rare that adults do also have testicular torsion on and off, but it's not common, was if undergone testicular torsion, does it affect infertility?
Yes, it will affect a person's fertility in any age, because in the testicle there is 2 types of tissue. The tissue that produces testosterone, and this tissue is very resilient to hypoxia, to lack of oxygen. And the other tissue, the one that produces sperms, this tissue is very fragile. The minute you stop the blood flow, the minute you stop the oxygen, those will be affected. Now, if you wait for 4 hours, most of this tissue will eventually die. Even if you fix a testicle later on and keep it, this function will be lost. So yes, it will affect fertility if a young man or a child has torsion and he doesn't come in time. Yes, it will affect fertility.
Right, and also with insurance, obviously with insurance, because it is a medically justified, it is covered by insurance. That was obviously another concern that one of our patients did log in for. So considering it is common with children, on average with the UAE, is there anything else that can be done in terms of for a child to keep them safe, to make sure it doesn't happen? If it's inevitable, it's inevitable, but
you can't do anything to prevent it, again, because we are talking about something that's genetic. It's a deformity. The testicle is not well fixed in the scrotal sac, not in everyone. There is something that we call gubernaculum. It fixes the testicle in the scrotal sac. So when the spermatocoel is pulling up the testicle to the inguinal area, that gubernaculum will keep it fixed down. So once the muscle relaxes, it will bring the testicle down to its own position. In those children, we don't have this. So you can't do anything to fix the testicle.
And there's no home therapies, there's no medication,
nothing
like that.
You provide Panadol. If the pain doesn't subside within 30 minutes to maximum 1 hour, come to the hospital. Now, answering the other part of the question about him and insurance, and if he has insurance and he's not sure about the hospital, still you come to the hospital, and insurance, we can take care of it later on. A doctor will not wait for insurance approval in such cases. We proceed based on medical necessity. Now, the family can claim back their insurance from, the money from the insurance, but they shouldn't wait. Or they can go to government sector.
Right. So, doctor, another concern was, you mentioned it is hereditary?
Yes.
Okay, and if there is a child or 3 brothers, obviously, would you recommend that the other children do?
Not do surgery, but just
get checked out.
Yes.
Okay. I think that about sums up most of the questions that we actually have with regards to the topic. However, before we do come to a close, is there anything else that you'd like to add on for our viewers with regards to the topic specifically that we may have not covered?
In regards of torsion?
Or anything else related to urology, by all means.
We had this one case that the school brought the child to the hospital with testicular pain. And I would advise also the schools, if a child is complaining of testicular pain, not to wait, not only the parents, only schools. If a child is complaining from testicular pain, not to wait, either call the parents or bring to the hospital, the same what the hospital did, same what the school did with us. They brought the child and they called the parents, which was a very good move.
Right, brilliant. All right, thank you so much, doctor. Once again, we have with us Dr. Hossam Sakir. I hope we've actually answered all of our viewers' questions and concerns this afternoon. I hope we have covered all interests. Now, before we leave, just to highlight, Saudi German Hospital is highlighting campaigns up until the end of the month for Prostate Cancer Awareness Month. We have a prostate enlargement screening program as well as a prostate cancer awareness screening program as well. So that's available Mondays and Wednesdays. If I'm not mistaken, yes, it's Mondays and Wednesdays. They have to make an appointment with us and come in for your free screening as well. It's 120 dirhams, not a free. So you get your consultation, you get your ultrasound, and you get your blood test included. I think that's about all the time we have this afternoon. Thank you, Dr. Hossam, once again.
Thank you.
You can call 800-2211 for appointments. May you all have a pleasant day. Thank you so much for watching, and stay safe. Thank you.
Thank you.